Okay, so go through and then draw back. If you get negative pressure where there's no air in there, that's good. That means you didn't puncture all the way through. Slowly give. When you pull out, put your finger on and kind of just rub.
Mm-hmm.
Okay, and so that's the anti-nausea medication. Another one. And then I'm going to have you here and draw up. This one's cefazolin, which is an antibiotic. And so, how you draw this up is like this. Kind of push down on this needle because sometimes they become loose in the shipping. Push down. And then invert the bottle. Like so. You're going to drop 1 whole mil. So a whole syringe. I draw past a little bit because there's a little bit of air in there.
Mm-hmm.
And then I just push up to the 1 mil mark. And you want to measure to this top of the plunger, not the bottom of it, because if you go to the bottom of it, it's giving a little bit less.
Okay.
And so we want to go to the top of the plunger, like that. And then just make sure if it's completely inverted like this. If you do it to the side, you're going to get air in there, and you don't want air. Okay, and take it out. Careful recapping so you don't poke yourself. And then draw back again on this one so you get air in there. We're going to change the needles to the 23 gauge needles. And they're the orange ones, just because they're a little bit smaller. And so how you open these, you just twist like that, it pops off. And keep this elevated up, twist this off. Take this, push it on there, and then push back up to the 1 mil mark. That gets rid of all the air. If there's a couple of air bubbles, sub-Q is not going to hurt. And then I'm going to have you give this one. And so just rub the area, that just so you can know how it feels like. And then I can walk you through how to do it. So just rub the area and then tent it and then just go straight in. Make sure you don't puncture through the sides. If you do, just back up just a little bit. And then draw back on the plunger and give it slowly.
Okay. Yeah, I don't think I want to do this because I'm probably have my dad do it.
Okay.
Oh, I didn't see it. I'm not even going to do it.
These little syringes are kind of a pain. There we go.
Poor girl. Oh my God.
Okay, so you can see the kind of the bevel. It's like a shovel almost. You want to make sure that part is up because if you give it this way, it's going to force it to go deeper, and we don't want that.
So keep that
Keep
up
that
right
part,
there. Okay.
like as if you're shoveling
Oh, okay, gotcha.
into your skin. And so I just desensitize the area, and then you want to take your second hand and tent the area. Yep.
Okay, we're at that.
Just right in the scruff.
Okay.
Yep.
Right
And
here?
then, yep. Go at the bottom of the tent that way, and then keep it kind of drop it down just a little bit.
What do you mean drop it down?
Because we want this a little bit more.
Oh, so
parallel
like
with
more,
her.
okay.
Mm-hmm.
How do I know if I'm in?
And then keep going. Feel the pop. There you go. And then you can let go with this hand.
Okay. Am I doing this okay?
Yep, you're doing it great. Okay, and then once you're done, just put your finger on there and pull straight out. There you go.
That's
and then I just rub.
Oh, you just rub it?
Yeah. Once she starts feeling better, she's gonna be like, hey, you're hearing why you're poking.
Yeah.
But right now, she's just feeling so out of it. And I'm gonna send home an empty one of these.
Mm-hmm.
For you to put all the needles in,
Okay.
and then bring it back to us once you're done with it. Just because we don't want these in the garbage. I'll keep the ones. I'm gonna take these here.
Okay. Do any of these get refrigerated or?
The one that needs to be refrigerated is
This
just the cefazolin, the antibiotic. And I'm sending home an ice pack so you don't have to worry about it right now.
Okay.
But once you get home, I would toss it in the fridge. So I'm sending home enough for 3 days, and an extra one just in case you drop it, because you want to keep this as sterile as possible. All right. And so, okay. And so next we're going to give her fluids under the skin. And so this is going to help rehydrate her since she's not going to want to eat or drink first as of right now. And this one kind of looks a little the weirdest pretty much, just because she's going to have a bubble on her back from the fluids, and kind of like a camel. And so this also has B vitamins in it and just a little bit of KCL.
And this is only for today, right?
This is, I'm going to give her 400 mils today, but then you guys are going to continue twice a day. So once in the morning, once at night, 250 mils. And so I'll show you how to read that.
Okay.
And I'm just priming the line right now, so there's no air bubbles. And we'll prime the second bag as well. Okay. Okay, and so the green ones are for the fluids. They're a little bit larger, just because we want it a little bit larger, because it goes faster, and actually hurts less than the smaller needles. And the smaller needles kind of shoot the fluid in quickly, and these kind of nice and slow. But at a faster rate without, kind of like a hose, if you have it on a smaller nozzle, it shoots out really fast. But then if you have it on a bigger nozzle, it shoots out the same speed, but not as high pressure. Okay, and so same with this one. You're going to just desensitize the area. And then bevel up again, like that. Poke through. And kind of just move the fur so that you make sure you're not puncturing through. If you puncture through, you'll see fluid coming out. Then just back up the needle a little bit and reposition. And then how I make sure it's not in the muscle is I pick the fur up. And if the needle comes with me, I'm not in the muscle.
Okay.
Okay? All right, and so once that's in there, I'm going to give 400 mils, so to that mark. Next time you all give it, you're going to go to the 5, 6, 50, because it's 250
So right
mils.
here.
You're going to come right here, right around there. Okay, if you're doing it with somebody, you can have them squeeze a bag, or you can hang it up high, whatever works for you, because it will work via gravity. It's just going to take a little bit of time. But if you have somebody holding the bag, they can squeeze it. And you want to make sure it stays up and down, because if you flip it upside down like this, you're going to get air, and so we don't want any air in there. A couple of air bubbles is okay. It's not as deadly as if it goes IV. It's okay to get a little bit of air under the skin. And you just want to kind of squeeze. All right. And so as I'm squeezing this, I'll go over kind of what else, what the doctor kind of talked to you about, and then just all in writing for you. And so this is your copy. So she presented for evaluation of vomiting and appetence and diarrhea. She was diagnosed with a virus called Parvo virus. Because Parvo is a virus, there's no medication to treat actual Parvo, so you just treat the symptoms. Antibiotics only kill the bacteria, and since parvovirus is not a bacteria, and so it feels a little bit weird, and that's normal. It doesn't really hurt them. They have, unlike with humans, they have a lot of subcutaneous space or subcutaneous space, and so it doesn't hurt them. It feels a little weird, and then after we're done, they're like, whatever. It feels a little bit weird when the fluid's cold, so you want to keep this at room temperature. If you put it in the refrigerator, they're really not going to like it, and it's going to drop her temperature.
So just keep it out.
Keep it out. Okay, and then, as you know, it acts in not fully vaccinated adults and puppies, killing rapidly dividing cells, primarily in gastrointestinal tract, bone marrow, causing severe inflammation of the GI tract, profuse vomiting, bloody diarrhea. It also puts them at risk, a higher risk of infection. That's why we get them started on the antibiotics, because of the fact we want to prevent the infection secondary to the parvovirus. All right, and then it's shed through the feces of infected animals when they defecate. Because it remains hardy in the environment, it can live on surfaces such as sidewalks, grass, dirt, rocks, surfaces of your house, clothing, bedding, any of that stuff. It can live on there from anywhere from 12 months to 18 months, sometimes even longer, depending on where it's at. Only thing that does kill parvo is a bleach, but you can't necessarily bleach your whole house, because no matter where this puppy is, you can bring it in on your shoes. They can bring it anywhere. You pick it up, bring it somewhere else, and so it's impossible to disinfect everything. All right. And then it also remains infectious to other dogs, especially those who are not fully vaccinated, including adult dogs that are not current on their vaccines, or puppies that have not completed their full set of puppy vaccines at the beginning of 6 weeks until they are about 16 to 20 weeks old. And so once she's completed with this, she'll be vaccinated technically for this strain of parvo, but there's other strains of parvo that they can get because it's getting smarter. And so we just want to watch it closely, and we want to, once she is feeling better, we need to continue on with her vaccines at a veterinary office. Just because unfortunately, some of the feed store vaccines, they're not handled properly, and we don't know which ones handle them properly. Whereas at veterinary clinic, we know they're handled properly. Because if they get warmed at all to room temperature and they're not given and then re-chilled, it kills the vaccine. All right. And then if she survives this illness, she should not come in contact with puppies or should not be taken out on walks to dog parks for the next 2 months, just because she can still shed the virus through her feces. Even though she's healthy, she can still shed it in her feces. And then also she doesn't recommend letting any puppies or unvaccinated dogs in your house for at least a year, if not longer, and clean all areas as possible with bleach. And I think she wrote so she wrote on for the solution that we use to kill Parvo of the bleach. So 1 part bleach, 10 parts water. You must remain in contact with the surface for at least 10 minutes to be affected. And so it also, unfortunately, has to be in a clean area. On dirt, it's not going to work because bleach doesn't work on dirt and whatnot. And so, like on the countertops and all that. All right, and then if she survives this illness, she will not be considered at risk for contacting parvovirus again if she survives this illness, but she should still get her other vaccines because she's still at risk of getting the other diseases that the vaccines cover. That I've already mentioned. And then she's recommending seeing your regular vet in 1 to 2 weeks when she's feeling better to get updated on her vaccines or get her back started on her vaccines. Alright, and then as of right now, we're not able to pursue hospital treatment, which we understand. We just have to recommend it just because that's the best treatment for them. But we understand it is fairly expensive. And so, but she still has a good chance of recovering at home.
God, man, she might be usually. Oh my God.
I know,
how long does it take to go low?
It takes anywhere from 8 to 12 hours. And so since she's so dehydrated, it's probably going to be closer to the 8 hours. And you'll notice once I stop, it's going to kind of disperse out. And in the morning, it's going to be more towards her chest because gravity's pulling it down. It doesn't hurt them at all. It looks weird, but it's just kind of like a camel hump. They absorb it as they need it. Okay, so we're sending her home fluids under the skin, which is what we're doing. And she's just saying, okay, so for the fluids under the skin, in which I wrote it on, you know what, I should probably write that. Give 250 mils under the skin, as I showed you, once every 12 hours until able to drink water without vomiting. And then also change the needle before each use, just because every single time you use it, it becomes dull. And so we want to cause as little pain as possible to her. Alright. If she continues to vomit for more than 3 days, even though she's on the anti-nausea medication, she needs to be further worked up at a regular vet or back with us.
And that's the vomiting one, right?
This one's the fluids. No,
that's
the
just the
vomiting
fluids.
ones.
Okay.
Yeah. This is the vomiting.
Oh, okay.
The Infinite or the Dolostrum. Sorry. So we have about 100 mils left to do. Okay, and then, oh yeah, okay. I was just saying that just be sure to bring the needles back here. Okay, and so what we're sending home is 2 liters of LRS, additives, KCl, 20 mil equivalents, and 2 mils of B vitamins. And I'm sending home, it says 1 drip set, I'm just going to set it up for you. And then the injectable medications that we're sending home, so the Antimet, which is this one, which I gave already. Next one is Cefazolin, which you gave. And so it's the 1 mil subcutaneously every 8 hours until gone. And I'm sending home a whole vial. Buprenex, which is a pain medication. This one is... This one's a pain medication, and I gave her a dose IV, so she won't need this one until tomorrow or later this morning at 7 o'clock this morning. So how you give this is just take this little stopper off and put it in her mouth, like at the side of her mouth, and slowly push this down.
Okay.
And it will go into her mouth and she'll absorb it through her mucous membranes. Okay. And there's two.
And that's the pain?
This is the pain in her neck, and it's also written on here too.
Okay.
There are 2 containers of this because they wouldn't all fit in one. We wanted to make sure she was comfortable for at least 3 days. And it's give every 6 to 8 hours as needed. If she's sleeping comfortable, not vocalizing, not getting up, getting down, pacing and all that, she doesn't need it. But if she's up, vocalizing, anything like that, then she might need a little bit of pain medication to help her sleep. Just because unfortunately this is a very painful virus. Okay, and then, so we're sending her home on antibiotics just to prevent, as a preventative measure, just to do the high risk of bacteria reaching the bloodstream via the damaged GI tract. And so that's why we're sending home the antibiotics. Even though Parvo is a virus, we want to pretty much prevent it from happening, or from her becoming septic, from pretty much the weak areas in her GI tract where blood is being exchanged. All right. And then she should remain indoors when she's being treated at home. She recommends keeping her confined in an area that she can't be too active. If you have a kennel, which is great, that would be okay to keep her in. It's not the most brightest area. Or if you have a bathroom that you can just seclude her to, so it's easy to clean, that would be good as well. We just don't want her running around, jumping around, because that's going to zap her energy, and then she's going to have to kind of like catch up. Alright, and then just keep her area clean and dry as much as possible. You may have a large amount of vomiting and diarrhea, and sometimes they're too sick to move out of it, and so we don't want to drop her temperature by her laying in her urine or feces or vomitus. We just want to make sure she's nice and dry and clean. And so blankets work okay, towels work the best because they kind of wick things away. If you have piddle pads or chuck pads, those work okay. Only thing is once they start feeling better, they decide to eat the piddle pads. And so I don't know if you've been working on piddle pad training her or not, but if she's okay with it, then that's okay as well.
The puppy pads.
The puppy pads, yeah. All right, and then, okay, so once she is eating and drinking with no vomiting, you can feed a low-fat cottage cheese and rice ratio 1-to-1. Offer about a teaspoon at a time every 2 to 4 hours, just because we don't want to give her a large amount, because if we give her a large amount on an empty stomach, it's going to come right back up, whether she's sick or not. And so we want to give her a small amount. If she's keeping that down, great. And then in about 2 to 4 hours from the first time you offer it, you can offer again another small amount. And then you can gradually increase the amount that you're feeding her if she's keeping it down for at least 2 days, but decrease the frequency. So if she's eating a teaspoon at a time, she's keeping it down, you can double it, and then wait 4 hours. And then if she's keeping that down, you double that again, and then still probably stay on the 4 hours, and then just slowly increase the amount, decrease the time that you're giving it. You can also, once she's eating that, keeping it down, no vomiting for at least 3 days, you can switch her back to her regular diet, but we want to switch her over slowly. We want to mix some of the bland diet with her regular diet, because if we switch all of a sudden to a regular diet after being on a bland diet for a couple of days, it can make her sick too, and then playing catch up again. And so you can just mix the bland diet into her normal food over a course of 3 to 5 days. And then she can be back on her normal food about 5 days after she starts eating well on her own. Okay, and if you have any questions, we're here, and we're also going to email your regular vet, let them know kind of what we did here, what we're sending home. That way you can contact them as well for follow-up. All right. Okay, and so how do you look at this? It's kind of pulled apart.
She's sleeping.
And we're right at the 4.
And then how you stop this is push this like this, and push this one down. And how you pull the needle out, you just pinch the skin, and pull straight back. Just pull straight back. Don't do it slow because you will jab yourself and it will hurt. It doesn't hurt as much because they don't have as many pain receptors on their back, whereas we have a lot on our fingertips. And then just kind of pinch it for a little bit because we don't want it to come back out. If a little bit comes out, that's okay. And then she's saying, oh, not diet. And so it's going to feel a little bit weird, but as you'll notice, it started out like a little bubble there, but now it's kind of dispersing down her back. And she'll kind of just absorb it as she needs it. And then, so even with the treatment, even if we hospitalize, she could still be at risk of dying. If she's not improving in 3 days, she needs to be seen. And then if she is, we need to continue on with the medication. So you can either call us or your regular vet. She may need her oral or injectable medication changed to oral medication. And so she's eating well for you. Okay? And then if she continues to decline or you think she's suffering, please consider humane euthanasia or contacting a pug rescue for help. Okay?